Happy Friday, February 20th. I'm Diana Braun, co-founder of the Knee Zone, and this is Dr. Raj Sinha, esteemed orthopedic surgeon, and also my husband. So we are the co-founders of the Knee Zone. Kathy Kelly has a question. Thanks for joining us live. So, this is a great question. So she has been doing her pre-op exercises, and no, I hurt more. Yeah. Is that normal? Absolutely could be. Feeling pain I haven't felt before. Okay. Like muscle pain or pain in the joint. The pre-op exercises we recommend are really focused on helping you get a little upper body strength, because you're going to be like pushing off with both your arms up and down for probably the first week to help you get up and down out of a chair or a walker. And then really you should be focusing on quads. I guess, when is your surgery, Kathy? And if you can share with us, like, hurt more is like, hurt is an interesting word. Is it muscle pain from working out, or is it like just knee joint pain? I think if you can drop that in the chat here, maybe we can answer that with a little more detail.
So pre-rehabilitation, getting the muscle strong going into surgery is important. The stronger you are going into surgery, the stronger you'll be coming out, the faster your recovery will be. All important. However, it is detrimental to increase your pain going into the operation, because your muscles actually start to shut down from the pain. It's called reflex inhibition. And so you got to balance that. You don't want, again, it's not a no pain, no gain sort of situation. This is where you want to do some exercises. You don't want to increase your pain and swelling. And if it starts to hurt, you're done for that day. Wait till tomorrow.
Yeah, you should not be in pain.
Increased pain.
Yeah, increased pain. That's concerning to me if you are feeling, increased pain. Kathy, I maybe talk to whoever's giving you your exercises. That this doesn't seem like.
Yeah, and make sure you're doing them correctly too.
Yeah, maybe.
If you started doing pre-rehabilitation, you might have also had the ability to see a physical therapist before the surgery as a prep visit. So make sure you're doing the exercises correctly. And they can modify them to things that don't hurt as much. So, there's any number of ways you can strengthen your quadriceps muscle.
So hopefully that helps. If you want to add any more comments, Kathy, we'll keep an eye on this there. And I'm going to go to Kaya. You're here. We just answered your other two questions. I hope you were able to hear them. So let's see here. Is it normal to have pain in the bones? In my lower leg, they ache, and I find it hard to get comfortable, especially turning my foot to the left. Yeah. So again, Kaya, you're really, really early into your recovery, and you're definitely in that phase that you're going to have some discomfort and ache along the way. So this goes back to, I think, what we were talking about. Your working on your straightening is really going to be important, and icing. With all the exercises they have you doing, I think that could be,
I suspect that's the
contributing a lot. It sounds like to us, again, we're going to emphasize, we're questioning why they have you doing so much. And I would really encourage you to talk to your physical therapist about why 14 different exercises twice a day. That sounds very excessive to us, and that they should be laser focused on making sure you're getting your legs straightened and giving you additional tips like we did earlier. And I think once that straightening happens and you back off on all the exercises that they have you doing, right now I think you'll get that full extension, that straightening, and that's going to get you much more comfortable with how that bone is feeling on the bottom. And remember, your body's trying to compensate right now. It's trying to make friends with this, and it's like using you're using different muscles, and you're not sleeping like you normally do. All these things are contributing, since you're only 7 weeks post-op. Yeah. Every week you're going to feel a little better.
I think a lot of that lower leg pain is from some residual swelling, which in your case I think is from really excessive exercise, from what I'm seeing you describing. Again, you still should be elevating that leg as much as possible. It's still fairly early in the recovery.
Yeah. Ruth has a question. Ruth, I was going to type you a little. Can you drop in here really quick, Ruth? When was your surgery? How long are you post-op? So she has a question. And Kaya, I hope that answers your question. Ruth, I have clunking at when I bend constantly. Is this going to go away? It is almost restrictive. Also, a lot of movement of the kneecap. So, Ruth, when was your surgery? For anybody asking us questions, it's really helpful if you let us know when your surgery was. I do remember, oh my gosh, like the sounds my knees would make after surgery. I'm like, I'm a robot. I don't think I like this. It does absolutely go away. I rarely hear mine make a noise anymore.
Yeah, so again, depending on timeline.
Yeah, timeline.
So
yeah.
Early on, you're going to feel clicking and clunking.
Yeah.
Because a lot of the tissues that stabilize your knee were taken out, and now the implant is doing all the stabilizing. Your body's still going to form tissue around that. So you've got a metal and plastic device that will click. Now, it should go away. If you're 2 years out from surgery, that's a problem.
Yeah.
If you're 3 months out from surgery, I would not be concerned about it yet.
Yeah.
In terms of movement of the kneecap, the kneecap does move side to side. That's normal. And even after knee replacement surgery, the kneecap does move side to side. That's normal. The kneecap, however, should not be dislocating out of the groove of the thigh bone. So if it is, that's a problem. But just slight lateral, medial lateral movement, side to side movement within normal limits.
So yeah, Ruth, we are going to be finishing up in 5 minutes. But Ruth, if you're here and you can let us know when your surgery was, that would be great. And then, Kathy, pop back on. Okay, so Kathy's getting ready for surgery on March 10th. So she's doing quad exercises, leg stretches, and
bends. Probably bends.
Bends, I'm thinking, yeah. Toe lift squats, those two. Definitely more popping in the knee with a sharp, jolted pain. Yeah, that's not good.
Well, I would also have you pay attention to each of those exercises and see which one, if it's just one particular one that's causing you pain, maybe you can eliminate that one. But, the toe lifts, I don't think that's that important, honestly. The quad exercises like tightening the quad and straightening the knee, that's important. The leg stretches are important. Squats, one thing you can do to help the squats be a little bit less painful is to lean up against a wall and do a wall squat. That takes some of the pressure off the quad and still helps you with flexibility and strengthening.
And you're just, and you're in the countdown. So yeah, try those and see. Faye, yes, I held it up earlier. So Knee Replacement Secrets is our book. And yes, it is on Amazon. It's called Knee Replacement Secrets. And it's on Kindle as well. So yes, please feel free to check that out. And Ruth is
4 months out from surgery.
4 months.
It looks like. So some of the clicking and clunking is still normal at this point. The knee should, however, feel pretty stable. If it feels unstable, that's something to talk to your surgeon about.
Yeah. Laying on your side. Oh, you're laying on your side already. That's good. 4 months. That's great. Not everyone can do that then. I think it is definitely going to get better. You still have swelling in that joint. It's gonna be annoying for a while, but it definitely is that. Laying on your side. I would really recommend some kind of like squishy pillow if you're not using that already. Ruth, between your knees. I talk about in the book experimenting with some kind of squishy like kid's toy or something that's really squishy to take some of the pressure off may help when you're laying on your side.
Kaya came back on real quick.
Okay, and then Kaya.
She's saying that she's clarifying her exercises. We're running out of time, so I
Yeah.
we have a hard stop. So let me just kind of jump to the end here. 3 sets of 15, 3 times a day is all you need to do, and you don't need to do all of those exercises. Pick 2 or 3 of them, and that's it.
Yeah.
That's what I would tell my patient.
Yeah. Kaya, for you especially, given where you are, you really, really, really need to focus on straightening. That needs to be job number 1 for you right now. So thank you for joining in, and we will make sure we see you or answer your questions soon.
Have a great weekend, everybody.
Bye.